Very good morning, students. Today we are going to begin with the antimicrobials, which are going to be called the protein synthesis inhibitors. Till now we have done the antifolates in the form of sulfa group of drugs and cotrimoxazole. We have also done fluoroquinolones, which are DNA gyrase inhibitors. So today we are going to proceed with the protein synthesis inhibitors. Among the protein synthesis inhibitors, students, you would be learning about aminoglycosides, you would be learning about the macrolides, you would be learning about tetracyclines and chloramphenicol and some miscellaneous antimicrobial agents. So to begin with, let us understand how the antimicrobial agents, they inhibit the natural process in the bacteria happening, which is the protein synthesis. Before we go to the exact way as how the antimicrobials inhibit the protein synthesis of the bacteria, we should know that the bacterial ribosome is different from the mammalian ribosome. They have two subunits, which is 50S and 30S, as compared to the mammalian subunits, which are 60 and 40. So the bacterial ribosome being different from the mammalian ribosome is enough to confer selective toxicity of these drugs on the bacteria and spare the humans. So that again I would like to tell you is not absolute, it is relative, and I would mention about it as we go ahead. Another thing about the antimicrobial agents, which are protein synthesis inhibitors, are that most of them are static in nature. Static means they halt the multiplication of bacteria rather than being cidal, except for the aminoglycosides from the established class of antibiotics or antimicrobial agents, which are having a cidal action. Rest all protein synthesis inhibitors, students, you can make a note, whether they are macrolides, whether they are tetracyclines, whether they are chloramphenicol or clindamycin for that matter, they are all static in nature. They are not bactericidal. So let us go for the synthesis, inhibition of the protein synthesis, how it happens in the bacteria. That, students, you need to know, and you also need to know at what particular step a particular antimicrobial is inhibiting which stage of protein synthesis. Is it inhibiting the binding of the incoming tRNA with its new amino acid? Is it inhibiting the formation of the initiation complex, or is it inhibiting the translocation or the transpeptidation? So as a second MBBS student, you need to know at which particular step is the protein synthesis inhibited by a particular antimicrobial agent. So for that, we need to know the whole process of protein synthesis. So these type of questions are asked as credit questions in your MCQs. So now coming to the protein synthesis inhibitors, I would like to inform the students that protein synthesis takes place in the ribosomes. The eukaryotic and the prokaryotic ribosomes are different, as I mentioned you, which provides the basis for the selective antimicrobial action. But students, I want to tell you this selectivity is not absolute, because the mitochondrial ribosomes of the mammalian cells, they resemble the bacterial ribosomes, and in that case what happens is that the mitochondrial ribosomes are affected. The bacterial ribosome is 50S subunit and 30S subunit. The mammalian ribosome is 60S and 40S. Other elements which are involved in the peptide synthesis are the mRNA, which forms the template for protein synthesis, the transfer RNA, tRNA, which transfers individual amino acids to the ribosomes, and ribosome has three binding sites for tRNA: the acceptor site, the peptidyl site, and the empty site. So let us now see what happens further. To initiate translation, the mRNA, which is transcribed from the DNA template, is attached to the 30S subunit of the ribosome. The 50S then follows the subunit, then binds to the 30S, and they form a unit which is called the 70S subunit. In the mammalian cell, the subunit is 80S because it is 60-40. Here it is 70S. This subunit moves along the mRNA such that the successive codons of the messenger pass along the ribosome from the A position to the P position. Now let us see what is the A position, what is the P position. A position is the acceptor site, students. The P position is the site where the tRNA is already present with the growing amino acid chain, and in empty site there is no tRNA. This is the binding of the tRNA with the proper codon-anticodon recognition. This is the largest subunit, which is the 50S ribosomal subunit, and this is the smaller subunit, which is the 30S ribosomal subunit. This is the tRNA with its amino acid, which is going to bind to the acceptor site first, and it is also going to bind with the codon-anticodon recognition. So let us see further, students. A ribosome with 3 binding sites, as you can see for the tRNA, the P, A and E sites, and you can also see the messenger RNA and the tRNA. This is the messenger RNA and this is the tRNA. The different mRNA codons, which are the triplets of 3 nucleotides which code for specific amino acids, are represented as wavy lines and are shown in different colors. As you can see here, these are the different mRNA codons in triplets, and sometimes it happens that the tRNA binds with abnormal codon-anticodon recognition, and that freezes the process of protein synthesis. Now let us see the first step. This is a tRNA with the growing peptide chain consisting of MET, LEU and T is already in the P site, which is already bound properly by the codon-anticodon recognition. Now this is the new amino acid which is meant to join this growing amino acid chain, and this incoming tRNA carries valine which is covalently linked. So this is the incoming tRNA with its amino acid. This incoming tRNA binds to the A site at the acceptor site by complementary base pairing. Now this is the first step which happens. This is the binding of the tRNA to the A site, and this binding, I would like to tell you students, is interfered by the antibiotic or the antimicrobial agent tetracycline. This step is inhibited by the tetracyclines, and tetracycline inhibits this step of the binding of the new tRNA with its amino acid, and tetracyclines are not cidal in nature, students. They are static in nature. Now we come to the second process which happens, that is the nascent polypeptide chain, which was earlier in the P site, comes temporarily to the A site, and this aids the binding of these already existing amino acids to the new amino acid which has come in with its new tRNA, valine. So for a point of time or for a temporary position, the already existing nascent polypeptide chain will migrate into the A site and join with the new amino acid which is valine. So this is what is the reaction which is called transpeptidation. That is, the peptide chain on the tRNA in the P site is transferred to the tRNA on the A site. For this is a temporary phenomena, and the peptide chain attached to the tRNA in the A site, that becomes full now, complete now, and that consists now of MET, LEU, TRIP and valine. Is it clear? Now this whole thing is going to migrate to the P site, allowing the space again for the new tRNA with its amino acid. So this is a process where the nascent polypeptide chain goes temporarily to the A site and then it merges with the new tRNA, and this whole complex is now going to migrate to the P site. The tRNA in the P site has been discharged. That means it has lost its peptide. This loss of peptide by the tRNA which is in the P site is permanent, student. This is permanent. Now the discharged tRNA which has lost its amino acid chain is now transferred from the P site to the E site. E is standing for the empty site. The tRNA with the growing peptide chain now is translocated. The same tRNA which was in the A site with 4 amino acids is now transferred to the peptidyl site, so that this site remains free to allow or to invite an incoming tRNA with the new amino acid. So the discharged tRNA is now transferred to the P site. From the P site to the E site, the tRNA with the growing peptide chain is translocated from the A site to the P site, and this process is called translocation, students, and the ribosome moves on one codon relative to the messenger. And this process of translocation, the earlier process was transpeptidation, students, where only the polypeptide chain moved to the acceptor site. This process, I told you, is inhibited by chloramphenicol, and this is the process of translocation, which is inhibited by macrolide. And the students, macrolide are also the drugs which inhibit the protein synthesis inhibitors, and they are also static in nature. They are not cidal in nature. Now the tRNA from which the peptide chain has been removed is ejected. It has no place now in the protein assembly, and the new tRNA with the amino acid, which is now M coming forward, is attached with the relevant anticodon, now moves into the A site, and the whole process is thus repeated. Now in this figure, I failed to mention, or did not mention, where exactly the aminoglycosides are acting. The aminoglycosides are lethal. They are not static, students. They are bactericidal, and the first important step they inhibit in the protein synthesis is that they bring about abnormal codon anticodon recognition. So as a result, there is formation of aberrant proteins and formation of abnormal initiation complexes, which are called streptomycin monosomes. So that I'm just going to come in a while to you. So let us revise it. This is a mRNA with the 50S and the 30S ribosomal unit. There's a competition with tRNA for the A site, and that is competition is given by the tetracyclines, which selectively they inhibit the binding of the new tRNA with its amino acid to this acceptor site, and more mechanism of action we will deal later. Selectivity is largely through selective uptake by active transport into the prokaryotic cells. The tetracyclines are actively taken up by the prokaryotic cells. That is what it wants to say. And this is the process, that is, they will inhibit the binding of the new tRNA with its amino acid, and neither will the binding happen, neither will all the processes then result. So this is mechanism action, students, of tetracyclines. This is the mechanism action of the aminoglycoside, students. We are going to go in detail a little while. It causes abnormal codon anticodon recognition, which leads to misreading of the message, formation of aberrant abnormal proteins, and aminoglycosides, you know, are gentamicin, amikacin, tobramycin, and many such agents. Then the process of transpeptidation, that is a nascent polypeptide chain moving temporarily to the A site to join the new amino acid. This process, students, is inhibited by chloramphenicol, which is also a bacteriostatic agent. And finally, the process of translocation, that is the movement of the whole tRNA with the new amino acid attached, which will migrate from the acceptor site to the peptidyl site. This process of translocation is blocked by erythromycin and another drug which is called spectramycin, which is our limited uses, and this is the mechanism action of the macrolides, students. Now this part we are going to do with the aminoglycosides first, and let us go to the aminoglycosides, students. They are the most important protein synthesis inhibitors, you should know. They have a cidal action rather than the static action, and that makes them one of the very useful drugs in the wards. It is these drugs are very, very polar. They cannot be given orally. They have few indications for oral use, but they are given parenterally. That means if they are given parenterally, they are meant for hospital use, and aminoglycosides, like penicillins, have a very narrow spectrum of action. Unlike fluoroquinolones, which have a broad spectrum of action, the aminoglycosides have a very narrow spectrum of action, primarily concentrating on the aerobic gram-negative bacilli. So we have already touched upon Waxman as a discoverer of streptomycin when we were doing the introductory part of antimicrobial agents, but I would like to mention or revise again with the students that the streptomyces species from which streptomycin was isolated was the first antibiotic which was effective for tuberculosis, and such was a phenomenal discovery that Waxman was given a Nobel Prize for the discovery in 1952. Now let us have the common properties of aminoglycosides before we proceed to its mechanism of action. All of the aminoglycosides are very water soluble. They are very polar in nature. So if a drug is very water soluble and polar, there are two things which can happen to the drug. One is that this drug will have limited usage as far as the oral administration is concerned, because you know that lipid solubility allows good absorption. Water solubility or polar compounds are less absorbed by the body. So the aminoglycosides are usually given parenterally, intramuscularly, or they can be given intravenously. They can be given as local drug delivery systems, but they are usually avoided to be given orally. So one of the common properties which are common to all aminoglycosides is their extremely polar nature. So let us go to their common properties. They have common toxicities. They have a common spectrum of action also, students. So this time sometimes it can be asked as a short note. They have a narrow spectrum, as I told you. They are active against aerobic gram-negative bacteria. They are not active against gram-positive bacteria. They are active against aerobic gram-negative bacteria. Of course, they are active against some gram-positive bacteria. They are also active against some atypical microorganisms, which we are going to touch upon it later. As far as their pharmacokinetic properties are concerned, they are having poor oral absorption. They are all polycations and they are 99% ionized. So if the drug is ionized, it is not able to get absorbed. So if the drug is not polar or not lipid soluble, it is not going to permeate across various body tissues. So these drugs have limited distribution. They cannot cross the blood-brain barrier. They cannot reach the body compartments also. So thereby, if you want to give these drugs to various body compartments, you have to give them via local drug delivery. So if you want to have these drugs across the brain, you might have to choose the intrathecal route or the intraventricular route of drug administration, which is not a very comfortable route of administration because these drugs have a limited passage across the cerebrospinal fluid barrier. So they have a limited distribution, students. Of course, but where there are raw serosal surfaces or burnt surfaces, these drugs can be absorbed via those surfaces and they can contribute to systemic absorption and toxicity in return. They are excreted unchanged by the kidneys. You know, kidneys exert only if the drug is lipid soluble, where the liver comes into picture, where it metabolizes the drug into a drug form which is inactive and which is water soluble. But since these drugs are already water soluble, they are excreted in the active form unchanged by the kidneys. So if the drug is excreted unchanged by the kidneys, students, you have to note that the kidney functions have to be optimal, because if the kidney doesn't flush out this unchanged drug, it is going to contribute to toxicity. So aminoglycosides are one such drug whose dose modification is warranted if there is a renal impairment. All these drugs are autotoxic in nature and nephrotoxic in nature. These drugs, they concentrate in the inner ear as well as the vestibular fluid and the labyrinthine fluids, and that I think this drug gets into via passive diffusion. If the blood concentrations in the plasma are high of the drug, then this drug is going to go to these compartments, the vestibular cochlear apparatus, in high amounts. And on one end we are talking about the fact that the aminoglycosides are very polar in nature. They cannot cross the body compartments, but yes, they accumulate in the endolymph and the perilymph of the inner ear, and that leads to autotoxicity, in which in many cases, students, can be irreversible. These drugs are also concentrated in the renal cortex, and that is why they cause nephrotoxicity. They are concentrated in the kidneys, and that is one of the reasons they are given for complicated urinary tract infections. For upper urinary tract infections, pyelonephritis, which can be caused by E. coli, the aminoglycosides are one of the drugs of choice for pyelonephritis or complicated urinary tract infections. They are drugs of choice for serious gram-negative infections, and streptomycin over and above is useful for eradication of Mycobacterium tuberculosis, which causes tuberculosis. And although these drugs are having good activity against aerobic gram-negative bacteria, but they do not have any activity against Salmonella, which causes typhoid. So remember that aminoglycoside students are not active for typhoid, because Salmonella, it doesn't have any activity against Salmonella, and for typhoid fever we have to resort to fluoroquinolones, which are the drugs of first choice, or we have to resort to the third generation cephalosporins. So we need to know that these are the common properties of the aminoglycosides. They have a spectrum which is narrow spectrum for gram negative. Their pharmacokinetic properties are that they are very water soluble, they are 99% ionized, they have a poor oral absorption, they have limited distribution across the body compartments, except that they concentrate in the endolymph and the perilymph of the inner ear. They are excreted, remember students, unchained by the kidneys. They are a group of antimicrobial agents which require dose modification if there is a creatinine clearance which is going wrong, or creatinine clearance which is impaired in patients. As far as the aminoglycosides go, they are classified as systemic use as well as the local use. The systemic use aminoglycosides are streptomycin, kanamycin, both are given for tuberculosis, tobramycin, which is given for pseudomonal infection, which is derived from streptomyces, the soil fungus, and that is why there is an E in between, streptomyces. And why I am telling you this, that there are two aminoglycosides, which is gentamicin and cisomycin. I am talking about this MY, students. This MY of streptomycin, kanamycin and tobramycin we get from the myces, streptomyces species. As you see, the gentamicin, the pronunciation is same, but it is gentamicin if you want to pronounce it very clearly, cisomycin, and they are derived from the soil fungus Micromonosporum, not streptomyces, from Micromonosporum. So this I comes from the Micromonosporum. So this is the difference. Sometimes it can be asked in the examination. Streptomycin, kanamycin, tobramycin from streptomyces species. Gentamicin, cisomycin from Micromonosporum species. So that is why there is no Y in gentamicin and there is no Y in cisomycin. Same for topical use, we have these which are obtained from streptomyces species. Neomycin, which is the most nephrotoxic aminoglycoside. Fremycetin, which is meant for local use as ointments and creams. And perimomycin, which is also meant for local use for eradication of intestinal amoebiasis. Students, we are going to go in detail in a short while. Then there are some semi-synthetic aminoglycosides, which are amikacin, which is one of the reserve aminoglycosides, which is resistance develops very late to amikacin, and netelmicin, which is also obtained actually from Micromonospora, but it is semi-synthetic, not purely natural in nature. Streptomycin, kanamycin, tobramycin, gentamicin and cisomycin are antibiotics in the truest sense. Amikacin and netelmicin are semi-synthetic aminoglycosides. This is the structure, students, of aminoglycosides. You don't have to remember the structure. It's a pretty complex one. Just you should know that there are three moieties here. The streptidine moiety, which is the side chain, the streptose, and the N-methylglucosamine. These are the glycosidic linkages, and this is the streptose, which is the nucleus of the aminoglycoside. And these are the amine side chains, and these are the glycosidic linkages, and combined this nucleus and the glycosidic linkages are called streptobiosamine. They are water soluble in nature, and these drugs are more active at alkaline pH, because at an alkaline pH the environment is such that it can take up the aminoglycoside. The transport mechanisms operate at alkaline pH. In acidic pH, the transport mechanisms to transport aminoglycosides inside the cell, they don't operate well. So these drugs are active at alkaline pH, and they are not active in anaerobic circumstances, students. So this is the spectrum of activity of the aminoglycosides. I told you they are narrow spectrum, active against gram-negative aerobic bacilli, but not active against salmonella. Remember this thing, students. They are not active against salmonella. They are very, very active against enterobacter, active against E. coli, which is the culprit to cause urinary tract infection, Klebsiella, Proteus, and pneumonia. They pseudomonas. They are nosocomial pathogens, gram-negative, and they can cause ventilator-associated pneumonias. And Citrobacter, Acinetobacter. These are the gram-negative aerobes against which are active. The gram-positive aerobes, they are also active, usually in combination with the beta-lactams and Enterococcus species, to which gentamicin responds well. So students, up till now we have covered the major way the protein synthesis happens in the bacteria, and we have introduced the aminoglycosides to you. So I would be coming soon with part 2 of aminoglycosides, and they will be dealing with the mechanism action of aminoglycosides and the uses and the adverse effects. So students, till now I will take your leave. Thank you so much, students.